health plan to prepare for that, not only from a claims adjudication standpoint and getting our files in the necessary format to submit to Medicare and other governing bodies, but we also have a lot of training going on for our staff, our certified professional coders, to make sure that they're in full compliance with ICD-10 requirements, getting the necessary training for their recertification. And at Health Alliance, we've actually been partnering very closely with Carl and working together on some of those ICD-10 activities. The reason I stress medical record documentation on this slide is because any diagnosis code that is submitted for risk adjustment purposes has to have supporting medical record documentation to support that code. And really we'll be getting into more detail about that in a little bit, about what that medical record documentation should look like. I also have that procedure codes are not allowed on this slide, and the reason I did that is because for Medicare Advantage, it is not at all based on CPT or procedure codes, HCPCS codes. It's all ICD-9 driven, and it just really it reiterates the importance and the industry standard to moving to more diagnosis coding than some of the fee-for-service practices going on today. There are a couple of risk adjustment models that I want to touch on. At our health plan, we are predominantly seeing retrospective models and concurrent models. The retrospective model is really that our payment is based off of ICD-9 codes submitted in the prior year. So for Medicare Advantage purposes, for payment year 2014, those payment rates are based off of ICD-9 codes that are submitted during 2013 dates of service. So it's a one-year lag. For the commercial exchanges, I'm going to take a step back there. For Medicaid, it's also a retrospective model. However, it's going to be based off the state fiscal year. So the 2014 payment year will be based off of the 2013 fiscal year from July through June of the prior year. So that's how they'll determine our risk adjustment factor on those retrospective ICD-9 codes. There's also a concurrent model. This will primarily be seen in the commercial exchanges or marketplaces as they're being referred to now. And essentially what that means is they'll determine our risk adjustment factor for 2014 based off ICD-9 codes that are submitted in 2014. There are also rules that Medicare Advantage plans and payers have in regards to how they can affect these risk adjustments or codes that are being submitted for payment based on a risk adjustment model. Today, as a Medicare Advantage plan, and also as we enter into the commercial exchanges and marketplaces, we do have the ability to conduct retrospective medical record reviews. We can go back in time for a certain period of time and pull medical records to see if medical record documentation supports submission of additional codes to Medicare or the governing body for additional payment purposes. For Medicaid, however, there will not be retrospective submission allowed. That is why it's extremely important that we're having this discussion tonight, is because those codes that you submit at the time of claim submission become what is determined for risk adjustment purposes.